and welcome to Healthcare at the Edge, where we explore the intersection of healthcare and technology. My name is Samuel. In today's video, I want to talk about telemedicine. Hey, think back with me, if you will, and imagine a time when telemedicine did not exist. Imagine the only way to see your doctor or care provider was to call the office, schedule an appointment, drive to wherever the office was, and then wait around, all the different antecedents that go with visiting a doctor in their office. And nowadays, you can open up an app on your smartphone or tablet or on your computer or whatever you got, and you can be visiting with a doctor in a real way. And in fact, we saw such an explosion of telemedicine during the initial stages of the pandemic. It was really remarkable to see almost an overnight switch was flipped to get patients visiting with their doctors and continuing their care in a virtual format, really overnight. Quite remarkable. Now, one of the key factors to that was the fact that reimbursement models changed, and the fact that the health systems were able to bill for clinical interactions in a similar, if not the same way as they would for via telemedicine, as they would if it was in the hospital itself or in the office itself. And so that was a significant factor to the adoption, and they relaxed a lot of the different rules. The regulatory bodies here in the United States relaxed rules to allow providers to see patients across state lines, which was crucial for especially mental health providers, and allowing people to get care that they needed in a virtual format. So all of that was very, very positive. But we saw a little bit of a dip as the pandemic response and the reactions to it kind of lingered on and has carried on in the United States. So less people using telemedicine now, but it's here to stay, in my opinion. I don't think the gains made in the population of how they can use telemedicine, I don't think those gains are going to go away. However, it's going to be a very consumer-driven healthcare application. It's going to be kind of an on-demand. It's really something where a healthcare user, somebody who needs to see a doctor, it may not be as used for long-term care and visits. They might still be into an office, but it's going to be for the random, the kid with a rash in the middle of the night that parents are worried about, or the odd thing that happened that you just want to speak to a doctor or a care provider about. I also see it being very effective in mental health care as well. I hope those restrictions are continuously eased or are actually permanently eased so that people can receive follow-up and counseling for their mental health, which is vitally important. So telemedicine is here to stay, but it comes with a lot of issues, and one of which, namely, is security. You got to make sure all of the data and information being sent is secured. And, sometimes, Zoom took a lot of flack at first for some of their lax security policies, which they have obviously rectified and improved upon. And there's very specific telemedicine companies and applications that have really risen to the front. Security is a crucial thing. But if you're a health system and you're wanting your providers to engage in telemedicine, you've got to make it easy for them, and you've got to make it secure for you. So imagine if you're a doctor and you want to see patients and you are doing it from the comfort of your home office, you've got to make that setup very easy. So as much as you can, think about, from an IT shop perspective, think about bundling everything that doctor would need: a good webcam, a good microphone, a good system, all of the pieces that go together for that, any of the different tools that they would need. Make sure you put a kit together. And if you can, be able to ship it out to them so that they can get it. And heck, if they can return it if they need to. And you also got to think about it from a security perspective. Now that the doctor is at home, what else is connecting onto your network? Can you extend your hospital's network in a secure way to that home office, if you will? All of these are considerations that have to be made for telemedicine to really long-term be as effective as it can be. But I think it's here to stay. It's going to be sticking around. Patients are going to want to be able to open up their portable devices and communicate with their doctor. Hey, let me know what you think. Put a comment below. Give this video a like so it can reach more people across LinkedIn. And I look forward to hearing from you in the comment section. Healthcare at the Edge is written and produced by Samuel Hill.